Welcome to a Minute with Maxwell Mission in Motion, a podcast where we dive into the stories, strategies, and sparks of inspiration behind the leaders transforming seniors' care across Canada. Today, I'm honored to be joined by Derrick Bernardo, President and CEO of Broadmead Care in British Columbia. Under Derrick's leadership, Broadmead Care has grown into one of the most respected continuing care organizations in the province. Known for its person-centered approach, innovative programs, and strong sense of community.
It's not about you doing all the talking. It's about giving your team the space to generate those ideas and opportunities for improvement, or even just celebrating, wins, or even focusing on some of your challenges and finding opportunities for, course correction.
In this conversation, we'll explore Derrick's leadership journey, from his very first job to the pivotal lessons that guide his decisions today. We'll talk about Broadmead Care's growth and how it continues to distinguish itself in a rapidly evolving sector. And we'll look ahead at what the future of continuing care might hold. I'm Heather Maxwell, and I would love for you to join a Minute with Maxwell Mission in Motion. So welcome to our podcast, Derrick.
Hey. Thanks for the invites. Really appreciate this. It's awesome.
Yes.
Glad to be here.
So excited to talk to you today, Derrick. So, Derrick, let's start at the very beginning. And when I say the very beginning, I mean, can you talk to us about what your very first job was? And what lessons did you learn there that you still carry with you as a leader today?
Yeah, I think for me, my first job was when I was I was a student, and I worked at a psychiatric hospital, and attending they called it at the time multidisciplinary team meetings. Now it's interdisciplinary team meetings. And think about this. This was in the 90s, so I'm giving away my age. We had these meetings. Think about this, in a smoke-filled room, because people were still smoking at the time.
Smoking
and
inside.
Besides the smoke, I was able to actually I was actually in awe in terms of how the team dynamics occurred amongst all the multidisciplinary team members at the time. It was everybody from the physician to the nurses to people in recreation to even people in housekeeping and laundry. And it really, for me, was quite compelling in terms of how they were serving their patients. And it took a team. And it took really good open dialogue amongst all the team members. And it really took me by surprise, because I always thought it was just the doctor making those decisions. So for me, it really taught me that, as a leader, you're given the authority. But for me to be an effective leader, you have to give the space for your team members to really generate good ideas and options in terms of the plan of care for that client.
Wow. That is so interesting. So really, right from your very first job, you saw how important collaboration was amongst a team.
Yeah, and it actually piqued my interest. And given the fact that my family, all of them are all healthcare providers or healthcare professionals, physicians, nurses, etc., that was also at the dinner table in terms of us, them collaborating or talking about best practice processes and so forth. So I was kind of like in the know from the beginning.
Wow, that's amazing. And it's so interesting how right from the very, early stages of our life, we can be impacted by our parents and our family and what they're doing for a career as well. My mom opened one of the first retirement homes in Ontario, and that really impacted me, seeing how, she was working with the residents. And, back in those days, as you're talking about a smoke-filled room, my mom used to drive all the residents around to all their appointments in her own car, and things like that would never really happen in today's world either. But back then, I got to see that as well. And that really impacted me to see how she treated the residents and that they were aging with dignity and grace. So it's so interesting, how those early days can impact us. So thank you for sharing that.
What I found interesting is that as my knowledge of teamwork evolved, the family and the resident or the patient or the client, soon became, informants to their own plan of care, which I think is perfect. It just
Yeah.
gives that wraparound service delivery for the client and really
Yeah.
focusing on patient or resident centered care.
Yeah. So important, isn't it? So important.
Mhm.
And was there a particular turning point, Derrick, or aha moment in your career that shaped the path that you're on now, would you say?
Oh yeah, I think the one I would say turning point was when I was given the opportunity to open a home, and this was actually
Oh,
very early in my career journey when I started in long term care because I had only probably 5 years total experience working in long term care as an administrator. Back then, it was called administrators. Now they're called executive directors, and that really showed me about leadership and you know doing what it takes to create a vision that you have developed from scratch and bringing
yeah,
together staff, hiring your own staff, your leadership team to create something quite special for the community. I think that was
yeah,
probably the turning point in my career. And there, I was working for, I'm not going to say a small organization in London, Sifton Properties, and they were opening this home, my first home I ever opened. I would spend, no word of a lie, till 3 a.m. in the morning looking at policies and procedures because
oh,
I had to make
wow.
sure, because as you know, in long-term care, we are heavily, scrutinized
Mhm.
and highly regulated. And I wanted to
Yeah.
be so perfect. I wanted everything to be perfect. And, that
Wow.
experience showed me that you can't always be perfect and you need to be, you need to set your expectations high, but know that, issues are going to rise and you're going to have to pivot quickly.
Wow, that's amazing, Derrick. And so, how would you describe your leadership approach today, Derrick? And how has it evolved over the course of your career?
Good question. It's actually it's a loaded question because, when when you're younger, I wasn't perfect in terms of my leadership style. I would oftentimes get very angry and show it to my team. I'm going to be transparent here. And it was Steve who pulled me in and really gave me, a lesson in terms of how to approach your management team and the style. Um,
Yeah.
when I was first a leader, I felt I had to know all the answers, but you don't. You
Yeah.
need to surround yourself with good people,
Yeah.
people that have the knowledge and expertise, and we have to be able to elevate each other when you're working collaboratively. And for me, when I was that young leader, I always focused on results. I was so results driven. I wanted
Yes.
positive outcomes. I wanted no findings. I wanted to be perfect. But
Yeah.
that soon changed because in long term care, there's ups and downs. But for the
Yeah.
majority of my career in Ontario, I did, get a lot of flawless reviews in terms of our annual reviews. But that's because I'm very competitive. I would say today, I would say I'm more collaborative. More strategic and visionary in terms of my CEO role, but more adaptive. And I think you have to be adaptive when you're working with various individuals because the younger generation have different views on work life
Yeah.
balance, right? So I had to really adjust over the course of the last, I would say, 5 to 10 years in my approach.
Yes. So much of what you just said resonates with me because I was very much like that in my early career. As when I first took on a leadership role, I just felt the need that everything had to be perfect, and it never is, right? It really never is. And also, we have to
Oh yeah.
learn that we don't know it all, and we're not expected to know it all. But that collaboration is so important to learn from others as well, right?
Yeah, and for me, when you're thinking about collaboration, it's not about you doing all the talking. It's about giving your team the space to generate those ideas and opportunities for
Yeah.
improvement, or even just celebrating, wins, or even focusing on some of your
Yeah.
challenges and finding opportunities for, course correction. So for me, it's about giving that space and empowering your team to, find a solution.
That's huge. That's huge. Absolutely. And so, Derrick, for those who may not know Broadmead Care well, can you give us an overview of the organization, who you serve, and what your mission is?
Yeah, so we're a nonprofit organization. We've been in existence since the 1970s. Broadmead Care started up as one site, Veterans Memorial Lodge, down here in Victoria. And we cater to all population groups, younger generation, seniors, the young disabled population group, and veterans. We have a Veterans Memorial Lodge, caters to veterans. We have priority access
Mhm.
beds. It's a unique model where it has a health center. We're the only one in Canada that has a health center for veterans that supports seniors in the community. We also have a number of programs that is supported by Veterans Affairs Canada, such as our music therapy, our horticulture therapy, all of these things to really improve the lives of our veterans, both Korean War vets and our World War II vets. In addition to that, we also have we also cater to seniors in the community within this one site. This then grew about 2010. We added three more homes, and then from there added another, and then to that we're going to be adding two more homes. So together we're going to have about probably seven homes altogether. Um, we
Wow.
have two more homes that we're acquiring, which will be seven homes altogether, and then we're also managing and operating a number of homes up island. So we're looking at expanding our growth up island because we know that there's a gap in terms of supports for long-term care and supports for seniors in general. Um, our focus has been on, and well, our purpose is to build communities so that everyone that we serve, and that's not just our residents and our families, but it's also our staff, it's our vendors, it's our community, you know, experience happiness and well-being. So we really look at what we do. We want to make sure that if anyone meets any Broadmead Care staff, that the experience that they have is positive and favorable. But we are growing, as you mentioned, and we are
Yes.
focusing on acquisitions. We're focusing on things like innovation, focusing on third-party management agreements. So we're really ready. We want to do things to support seniors in the community, and it's one of our strategic directions in terms of our strategic plan.
Wow. That's amazing, Derek. And it sounds like you take a very holistic approach to working with the populations that you work with. And that's a significant growth plan that you have. How are you going about managing that growth?
Yeah, good question. So it's really a collaborative effort between the executive team and our board, and we've set milestones in terms of our strategic plan in terms of growth, focusing on the types of growth initiatives we would be focusing on. There's basically three: and acquisitions, third-party management agreements, and innovation. So all those three key areas we've been moving forward for the last couple of years now, and it's been doing phenomenal. I'll be honest with you. When we look at acquiring or even acquiring a third party management agreement, our team, my executive team, we're very transparent in terms of capacity. So there's this constant reassessment of, do we need to add capacity? And I think it's important when you're growing that you continuously look at that, because there's a chance that if you continue to grow, someone's going to burn out. I'm always checking, and it's important. And in today's age, mental health is so important. We got to make sure that everyone's getting a good work life balance, except for the
Yeah.
CEO.
Well, the CEO probably needs it the most, Derek,
I
FYI.
know. I wish. I wish. But it is busy times for us right now. So sometimes you
Yeah,
do have to sacrifice a little bit, and my team does know that. But overall, I think we have good communication in terms of capacity planning for growth, and we really envision what we need to do. We've just had a session on how does growth look like in terms of the next 5 to 10 years, where we will be focusing,
yes.
where's our focus, and we are actually trying to focus up island because we know that there's a need there.
Absolutely. So that brings me to my next question, Derrick. Obviously, you're looking at the island in British Columbia, and it sounds like most of your growth will happen there as well. But how do you distinguish yourself from other continuing care providers? What makes your approach or philosophy stand out?
Me.
Of course. Why did I ask the question?
I'm kidding. I shouldn't say that. That looks really bad. No, you know what really separates us from the others is that, over the course of the pandemic, myself and the executive team knew that once the pandemic was over, staff were either going to retire early or they're going to resign. So we came
Yeah.
up with a plan to do a bit of a culture shift. And this culture shift generated a commitment. And that commitment is an internal facing commitment that really supports our staff, our residents, our families, our vendors, any partners that we come in contact with in our community. And that commitment is called You Matter. And the premise behind that is if you were approached or if you're being served by a Broadmead Care staff, how would you like to be left feeling? You want to be left feeling,
Mm,
you want to feel positive, you want to feel happy, you want to be respected, you want to make sure there's no judgment. So we've
yeah.
adopted this commitment, and this commitment is prevalent throughout all our homes. We've done tons of training. We have workshops. We
Wow.
have an orientation video that we've created that all new staff members have to go through. We also have You Matter champions at each of the homes
Mm,
that support the staff. So anything that doesn't go with the concept of You Matter, staff have the opportunity to report that to the champion. And it's up to the You Matter committee, and I belong to the You Matter committee. Um, we're the ones who sift and sort and determine how we can actually address those issues. And that You Matter committee is quite strong because it has a cross section of individuals from all our homes, from people from management, from our foundation to diet, to our dietary department, housekeeping, etc. So we have a cross section of individuals who support this program, and it has gone a long way in terms of retaining our staff. People feel valued, they feel respected, and they feel seen. The other area of focus for our organization to retain staff and to attract staff is that we've developed an innovation ecosystem within our organization and really focusing on innovation in terms of how we can move the dial forward in improving the care and services of our clients. So we made sure that in our innovation committee, we have a cross section again of all our departments. So all our departments know what each other department is doing. Because as we know, in any organization, when the dots aren't connecting, there's going to be failure, right? There'll be huge challenges. So we make sure that there's ongoing communication in terms of platforms. For example, if point click care is being rolled out with some new changes, everyone is aware because it's going to impact everybody, right? So these are the
Yep.
things that we feel is supporting us and how we present ourselves to the community.
Wow, I love it, Derrick. Innovation and people, right? So those are critical. And it sounds like you're doing an amazing job with that. That I love it. That is amazing. And so, can you comment a little bit more on some of the initiatives or programs you just mentioned that you matter? I love that. I love the concept of that. That you're most proud of and that are making a meaningful difference for residents, families, and staff.
Yeah, and I would say our You Matter commitment is one of them. An
Yeah.
initiative that we rolled out for the last 2 years is called the Long Term Care at Home program. We were
Oh,
able to receive funding from the federal government, but it's vetted through the Ministry of Innovation in the amount of $1.3 million annually till 2028. Now, this long term care at home
wow.
program integrates
Wow.
technology as well as home care support. So we partnered. So partnership is so important in this one. We have probably about eight pieces
Yes.
of technology that we can integrate into seniors' homes, as well as a number of home care supports. So seniors in our community have an array of of technologies to choose from, as well as home care supports, and it all varies. So what we learned is
Yeah.
that ministry wanted us to provide them with the exact same cookie cutter program, but as you know, each senior has different needs. So everyone has a
Yeah.
different program, and it's actually flourishing. We have about 105
Mm.
clients, and we've been given the green light to expand it to 200 clients within our communities. So we've been able to help. Where the goal of this program really is to support the long-term care wait list and hopefully minimize it and reduce the use of emergency departments as well as hospitalizations. So I would say
Oh,
that's probably one of the biggest initiatives that's been quite successful to date.
that is significant, Derrick.
Yeah,
Wow. So
yeah,
the people that want to stay in their homes can stay in their homes and have access to this technology, which is amazing. And as you said, it's also going to decrease hospital visits and things like that, which we know are very unsafe for seniors and also very costly, right?
yeah, yeah. And I think one of the biggest learnings here is that we need to make this consistent across the board throughout
Yeah.
the nation, throughout Canada. So I've
Yes.
connected with a number of individuals down east, and some people. I think we're the only ones who've actually initiated this comprehensive, robust rollout. So there's other
Wow.
partners in the east that are very interested in looking at how can we make a program consistent across the provinces.
This podcast is brought to you by Maxwell Management Group. For nearly 2 decades, we've worked side by side with individuals, teams, and organizations to uncover what makes them exceptional and to help them grow from the inside out. It's not just about reaching goals, it's about creating success that feels deeply authentic and genuinely meaningful. Organizations, like people, have stories. And when those stories are rooted in purpose, they become powerful forces for attraction, culture, and identity. We are committed to partnering with brands that want to lead with intention, cultivate vibrant workplace cultures, and become the kind of employer that top talent seeks out, not because of perks, but because of purpose. Over the past 18 years, I've had the privilege of leading Maxwell Management Group's growth into a highly specialized national executive search and education firm, one that thrives on values, vision, and the belief that when people lead with purpose, extraordinary things happen. To find out more about our executive search, recruitment, and education services, please visit us at maxwellmanagementgroup.com. And can you talk a little bit about what that technology is that the seniors can access if they want to stay in their home?
Sure. So simple things like the robot vacuum. Don't know if you heard of that.
Oh,
It's the
yes.
and then we have a electronic medication management system that spits out medication. It's called Medicube. We have falls detection that not only monitors their movements but also detects when they fall. We have three versions. One that is passive, so we can affix these. There are these discs that you affix to the walls, and there's no wearable for the senior, so they can walk around and it
Yeah.
detects whether a fall has occurred. If the senior is
Wow.
active, they will wear a wearable or a
Yeah.
lanyard. We have various types that they can choose from. We also have a doorbell a doorbell video camera because a lot of seniors were feeling
Yeah.
unsafe in their homes.
Yeah.
As we saw during
Yes.
the pandemic, people were feeling isolated and were feeling concerned
Yeah.
about falling. So we picked technologies that kind of aligned with some of their concerns. The
Yeah.
other area, of course, that we were focusing on, we had Alexa and also a
Mhm.
tablet and also
Wow.
lighting
Wow.
strips that could prevent falls, and it actually is used for
Wow.
wayfinding, so they can find the washroom, during the nighttime, because oftentimes seniors get up at
Yes.
night. So lots of
Yes.
technologies are currently in place, and for us, we're continuously pivoting. again, because we want to when we get feedback from our clients, we look at opportunities where we can pivot and provide perhaps technology or make a change in our
Yeah.
process.
Wow. That is so significant, Derrick. I mean, kudos to you and your team because, wow, are you ever working to ensure that seniors age with dignity and with grace? And if they would like to stay in their home, they can with all of this significant and amazing technology that we have in today's world. And so that actually brings me to my next question, which is what are some of the biggest misconceptions about continuing care that you wish more people understood? I personally think that continuing care has come a long way with the new technology that we have, and I don't think everyone is aware of that. But what are other, misconceptions that you feel people have about continuing care?
Yeah, it's funny because I've worked in Ontario, I've worked in Alberta, worked in BC, and a common theme seems to come up every time I meet a family member. Often they think they can just apply for long term care and get into a long term care home, but that doesn't happen.
Mhm.
And they're shocked when they have to wait a year or 2 years to get a bed. So to me, I think lots of education needs to be inherent in discharge planning or in the community, and we need to do that. And I'm very proud to say that we do that at Broadmead Care when we're meeting with clients with our innovation projects.
Mhm.
The other area of concern for me is that many families think that long term care is the same in every jurisdiction, and it's not. There's
Yeah.
different nuances. Like Quebec has I think they have that credit, that seniors credit
Credit, the senior
that they can
living
use.
credit. Yes, yes,
Yeah, to
yes.
support them, and we don't have that. And we have a mix of both public and private, and then there's Ontario that has, a lot of them is subsidized in terms of their approach. And long-term care is looked differently in terms of meeting standards and regulations in one province versus the other. So to me it's different, and unfortunately it's not consistent throughout Canada, and I think that's an area that we can improve on as a nation.
Yeah, so true. Wow, that's so interesting what you just said as well. You're right. Even from province to province, continuing care or long-term care can be quite different, right? And it's hard. It's sometimes difficult for
Oh
families
yeah.
to navigate all of that if you're not familiar with the sector, right?
Yeah.
And so the sector, as you mentioned, is changing rapidly, Derrick. From shifting demographics, we know that this is the first time in history that we now have more seniors than children, and to workforce pressures. What major trends or changes do you see shaping the future of continuing care?
I think first and foremost, and I think this is prevalent throughout Canada, it's that aging demographics and the need for more long-term care beds. That's high priority, I believe, in every province.
Yeah.
As we know, the boomer generation, by the time 2030 hits, it's going to be huge in terms of the need for more long-term care beds or even assisted living beds.
Yeah.
And I've noticed that working in three provinces, that there is this shift towards home and community supports for seniors. So really pushing for using technology to support seniors in our community and in our families. So I think for me, innovation needs to be inherent, I think, in every healthcare organization, because it's these small initiatives. If we all pull together, these small initiatives can really create big outcomes for our healthcare system and perhaps make a dent on our healthcare system. And hopefully we can, create a more efficient, effective, cost-effective healthcare system collaboratively. One of the other
Yeah.
areas of focus I know, and in speaking to some of my colleagues, particularly in the for-profit sector, is designing different models of care for
Yes.
seniors. And in our
Mhm.
new opening, we just opened up a new building a month ago. I think I failed to say that. It's Nigel House. It's a
Yeah.
campus of care. It's a mix of long-term care, independent living, and affordable housing. So we're
Yeah.
catering to seniors that have moderate to low income um, uh, um, incomes. And what we've designed it to be is more of a concierge model, more self-serve. So they use
Yeah.
technology to select. There's a concierge that supports them, not in their activities of daily living because it's independent living, but rather providing them with opportunities to go out. Not a formalized activity program, but again, more of an independent seniors apartment, I would say, with concierge services. So I would say that different models of care is definitely evolving through the years based on what we learned from the pandemic and definitely the change in demographics of our
Mhm.
seniors population.
Yes, wow. And so it sounds like Broadmead is really preparing to meet the changing expectations of the next generation of residents and families.
Oh, yes. So that's why I think the impetus for us to move forward working in the community, and it wasn't because it was a great idea. We wanted to really make a difference in seniors living at home. We noted during the pandemic that seniors were suffering. People were experiencing, isolation. They were experiencing safety issues. So we came up
Yeah,
with this innovation program, and it blossomed to now what was called now the long-term care at home program. And what we noticed is that we need to be educating our seniors in our community about how our healthcare system works, because when we rolled
yes,
out this program, people didn't know about home care. They were afraid
yeah,
to invite someone into their homes and
yeah,
support them in dressing, grooming, or what have you. But after
yeah,
speaking to them, educating them, it worked out. When we first trialed this,
yeah.
we had home care support program. No one used it for 3 months. But until our staff went in there and told them what it was all about, told them about the nuances with home care services, that the goal is to provide some consistent connection with someone from home care. Everyone's using it now. All probably 90% of our clients are using home care services to this day. And they also need to understand how our healthcare system works. So our people who go out into the homes really support that
Yeah.
education and training for our seniors, and it's working out quite well. So for us, we've been managing this in terms of this educational part, either through one-to-one, or we bring our clients to one of our sites and we do like lunch and learns in terms of not just the
Oh,
technology,
that's
but also
great.
the healthcare supports. So really creating that
Yeah.
more wraparound service for those seniors, yeah, and preparing them, right?
Wow, I love that lunch and learn. That is a fabulous idea as well. And as you said, it is a challenge. And I think education is huge because so many seniors are, you're absolutely right, and rightfully worried of letting someone into their home, right? But that's where also all of this technology can help, right? And the education is so critical to let them know what supports are in place, what supports they can access, and how that the technology that's there to keep them safe at the end of the day is so critical as well, isn't it?
Yeah.
And so to your point, Derrick, you've talked a lot about all of this support and the collaboration. And so workforce challenges, as we know, are a common concern, especially given your growth. What strategies, and you mentioned the You Matter, which is a fabulous program, but what other strategies are you using to attract, retain, and inspire people to choose a career in this field?
And so we've amped up our recruitment process for healthcare workers. Actually, for healthcare workers, we've been using resources like the HCAP program, which provides staff from the community, anybody that wishes to get into the healthcare field and want to be a healthcare worker. There's a program that government has provided in BC to support those individuals, and it's they get paid while they do this.
Mhm.
There's also so we utilize that 110%. We use it quite a bit, and it has supported our
Right.
healthcare worker shortage in ways that we wouldn't have imagined. It's really supported us in terms of our retention of healthcare workers and recruitment. The other area of focus, of course, is that we have special awards. In addition to our long-term service awards for our staff. We also have special awards for staff who've gone over and above in terms of leadership, in terms of innovation, in terms of being collegial with your fellow coworkers. We have an award called You're a Gem Award. Lots of awards are being supported by the executive team to acknowledge the good works that our staff are doing. Education and training is also another area that we focus on in supporting people who wish to pursue career advancement within our organization and giving people the opportunity to apply for internal postings as well. Health and Wellness Week is another area that we do
Yeah.
pretty much regularly, where we bring in, mental health workers, people who deal with massage therapy, physiotherapy, occupational therapy, teaching our staff about work-life balance. So we do this on an annual basis. And the thought is from our human resources department is that we will continue this monthly. We really want to support our staff in every way. And it's about creating that environment, that psychological safety, so that they feel comfortable when they come to work
Yeah.
and they come to work with no injuries or issues in terms of their physical and mental well-being.
And that is so critical, isn't it? That is so critical. So, when you think about the future of continuing care, Derrick, what gives you the most hope? And where do you believe leaders need to focus their energy over the next decade?
I think, and I think I mentioned this, I think like national standardizing our regulations nationally. I think it's important. And I think the other area of focus, of course, is funding. It needs to be consistent across the board, interprovincially and nationally. And for me, innovation, people need to be participating in it. They need to understand it. They need to start executing, because, as I mentioned, it's these small, initiatives that create bigger outcomes. And for me, workforce innovation. You guys, I know that you recruit, retain, we learn from you. It's about being strategic and how we can retain the best. I think those are areas of focus for operators. Another area of focus, of course, is always looking at ways in which we can better serve our seniors, and when we look at different care models.
We've talked a lot about collaboration, and how do collaboration and community partnerships factor into Broadmead's success and future plans?
Well, partnerships are so key to our organization, and collaborating with our partners is also a very key milestone for us in terms of achieving our goals. And for us, it's, this has helped us deliver better care, and it allows us to innovate. And when I say innovation, our partners are organizations like Envisage, Age Well, the ministry. So partners, you can't do anything in silos these days when you're in healthcare. And proof of the pudding goes, you see these standalone homes in BC, and all of them are divesting, their build and their operations, and because they can't do it alone, they need partners. So that's why we got into the third-party management agreement business. We wanted to support other homes within our community that don't have the infrastructure to manage their operation. So for us, partnerships are key, not just only in delivering better care and innovating, but also managing your costs and planning for, I would say, a sustainable future for the organization and the community.
So important. Absolutely. And so, when you think about the future of continuing care, what gives you the most hope? And where do you believe leaders need to focus their energy over the next decade?
I think that, again, innovation needs to be, I would say, a top priority for our operators and for our CEOs. And, things like using remote monitoring to support, patients in their homes, and rather than being hospitalized, or, creating these smart homes. People are starting to create and envision this for seniors living out in the community. And also the growing recognition amongst operators that there needs to be more of a national standards, right, and funding reform for our sector. The other area of focus, of course, is creating and designing new models of care for our seniors, really supporting seniors who have technical expertise, things of that nature, or designing something that is that focuses a lot on physical movement for the seniors. So there's ways of really creating that vision for seniors, and I know that my colleagues are looking at ways in which they can support seniors moving forward.
Mm-hmm. That's amazing, Derrick. And so, circling back to your own leadership journey, leadership often involves navigating uncertainty. And you've made a couple comments about being able to pivot. Can you share a time when you faced a significant challenge as CEO and how you and your team overcame it?
Yeah, the one word, pandemic. That was that was tough. Like I have to
Yes.
say, and at the time I was working in Alberta, and we had one site that had no staff, literally no staff, because all of them got COVID, and we were pressed. We actually, did an all points bulletin to all our homes across Alberta to look at ways in which they can come down and support. So we flew in a number of staff members to Edmonton to support this one home. And for me, when you're in that situation as a CEO, it's about remaining calm under pressure. And I'm going to say this because at the time I was going through a divorce. I'm going to add my
Mhm.
personal slant to it. So
Mhm.
it takes a very strong CEO to compartmentalize issues and really focus on areas where they need to in terms of meeting the safety needs of residents and the community.
Mhm.
But the other area that I also have to say is that empowering your team to make decisions during these critical events is so important,
Mhm.
and trusting them. And for
Mhm.
me, I know that some of my colleagues who I still keep in contact with, we still remember those days where many of us were quite vulnerable, and it's okay to be not okay and to
Mhm.
express yourself in a way that will lend support to their mental well-being.
That is so important. You're right, because none of us can do it alone. And we have to trust our teams as well, that they have the best interest of the residents at heart as well. And they're going to make the best decisions they can given the resources that they have. That's great, Derrick. And so for anyone considering career choices, would you recommend continuing care as a sector to, consider when you're looking at career options?
Oh, you know what? I would say yes, yes, and yes. It's just
Mhm.
there's lots of opportunities in long-term care and seniors care, and sky's the limit.
Mhm.
People that I've mentored in the past are doing so well. Some of them have become directors, some of them have become administrators, some of them become executives at the C-level suite, and are doing so well. So there's so much opportunity out there, and many times you don't even have to be a nurse. You can have education in quality improvement, health informatics. There's a wide array of opportunities in long-term care and seniors. I
Mhm.
like to call it seniors care because
Mhm.
that spectrum can go from assisted living to independent living to long-term care to working with seniors in the community. Um,
Mhm.
really robust ways in which you can really improve your career path.
And to your point, Derrick, thank you for raising that. There are so many different opportunities in long term care and continuing care. Some people tend to think, well, I'm not a nurse, I can't work in long term care or continuing care. But we need people in all areas like human resources, food services, maintenance, administration. There are just so many areas that we need people in continuing care. And so that I think that's important for our listeners to know as well, that there are lots of opportunities in continuing care. And I would encourage
Agreed.
people to look at what some of those opportunities may be.
Oh yes, no, I definitely tell my students that I work with that the opportunities are endless in seniors
Mhm.
care. So really stay in that area of focus, and I'm sure that they, and some of them have, and they've currently have done quite well in those areas.
Mhm. And finally, Derrick, if you could go back and offer one piece of advice to your younger self, perhaps that young person in your very first job, what would it be?
Oh, that's a really good question. My younger years, I'd have to go back so many years now. When you think about that. Okay, so yeah, no, I would, you know what? I would take risks because you never know how far you'll go.
Mhm.
And then I know that the one thing that I will always remember that my mentor always impressed upon me was to listen first, act second, and I guess never underestimate the power of like engagement and building relationships.
Mhm.
Yeah.
That is so critical. Building relationships, absolutely. And so, Derrick, thank you for sharing your journey, your leadership philosophy, and your vision for the future of continuing care. It's clear that your work at Broadmead Care is not only shaping the lives of those you serve today, but also setting a powerful example for the sector as a whole. So, thank you for being with us here today, Derrick.
It was my pleasure, Heather. Thank you.
And to our listeners, thank you for joining us on A Minute with Maxwell, Mission in Motion. We hope today's conversation sparked ideas, offered new perspectives, and reminded you of the profound impact leadership can have in this essential field. Until next time, keep leading with purpose, compassion, and vision. So thank you for joining us today. And if you would like to learn more about how Maxwell Management Group is supporting the continuing care sector, please feel free to visit our website at maxwellmanagementgroup.com. And also, please like and subscribe to our podcast wherever you download podcasts. Thank you for joining and see you next time.